So good day everyone. We are here to tackle about pregnancy due date. Your due date is not a prediction of when you will deliver. It's simply the date that you will be 40 weeks pregnant. Few women give birth on their due dates, but still, establishing your due date or estimated date of delivery is important for you. To estimate your due date, your healthcare provider will use the date your last period started, add 7 days, and count back 3 months. The due date will be about 40 weeks from the first day of your last period. Your healthcare provider can use a fetal ultrasound to help confirm the date. Let's move into physical exam of pregnancy. Your healthcare provider will typically check your blood pressure, measure your weight and height, and calculate your body mass index to determine the recommended weight gain you need for a healthy pregnancy. And also, your healthcare provider might advise some vitamin takes and eating habit that you must take. Your healthcare provider might do a physical exam including a breast exam, pelvic exam, and screening exams of your heart, lungs, and thyroid. The next test is the lab test. At your first prenatal visit, blood tests might be done to first check your blood type. This includes your Rh status. Rhesus or the Rh factor is an inherited trait that refers to a specific protein found on the surface of a red blood cell. Your pregnancy might need special care if you're Rh negative and your baby's father is Rh positive. Next is to measure your hemoglobin. Hemoglobin is an iron-rich protein found in red blood cells that allows the cell to carry oxygen from your lungs to other parts of your body and to carry carbon dioxide from other parts of your body to your lungs so that it can be exhaled. Low hemoglobin or a low level of red blood cells is a sign of anemia. Anemia can cause you to feel very tired and may affect your pregnancy. Next is to check immunity to certain infections. This typically includes rubella and chickenpox or the varicella, unless proof of vaccination or natural immunity is documented in your medical history. Next is to detect exposure to other infections. Your healthcare provider will suggest blood tests to detect infections such as hepatitis B, syphilis, gonorrhea, chlamydia, and HIV, the virus that causes AIDS. A urine sample might also be tested for signs of a bladder or urinary tract infection or the UTI. Next is screening tests for fetal abnormalities. This prenatal test can provide valuable information about your baby's health. Your healthcare provider will typically offer a variety of prenatal genetic screening tests, which may include ultrasound or blood tests to screen for certain fetal genetic abnormalities such as the well-known Down syndrome. Lifestyle issues. Your healthcare provider might discuss the importance of nutrition and prenatal vitamins, ask about exercise, sex, dental care, vaccinations, and travel during pregnancy, as well as other lifestyle issues. Normal discomforts of pregnancy. You might notice changes in your body early in your pregnancy. Your breast might be tender and swollen. Nausea with or without vomiting or the morning sickness is common. Talk to your healthcare provider if your morning sickness is severe. Your next prenatal visit, often is scheduled about every 4 weeks during the first trimester, might be shortened than the first. Near the end of the first trimester, about 12 to 14 weeks of pregnancy, You might be able to hear your baby's heartbeat with a small device that bounces sound waves of your baby's heart, or the Doppler. Your prenatal appointments are an ideal time to discuss questions or concerns. Also, find out how to reach your healthcare provider between appointments. Knowing help is available can offer peace of mind in every future mother. Let's move into the second trimester of pregnancy between week 13 to week 26. Your healthcare provider might first track your baby's growth by measuring the distance from the pubic bone to the top of your uterus or the fundal height. Your healthcare provider can gauge your baby's growth. After 20 weeks of pregnancy, this measurement in centimeters often matches the number of weeks you've been pregnant, plus or minus 2 centimeters. Next is to listen to your baby's heartbeat. At second trimester visit, you might hear your baby's heartbeat using a Doppler instrument. The Doppler instrument detects motion and conveys it as sound. Then assess fetal movement. Tell your healthcare provider when you begin noticing flutters or kicks from your baby. Keep in mind that mothers notice these movements at different times, and movement at this time in pregnancy is typically unpredictable. You'll likely notice flutters for the first time around 18 to 20 weeks of pregnancy. Here are the offered various prenatal screening or tests. Number 1 is the genetic test. Blood tests might be offered to screen for genetic or chromosomal conditions such as spina bifida or Down syndrome. If your results are abnormal or worrisome, your doctor will recommend a diagnostic test, typically an amniocentesis. During amniocentesis, a sample of the fluid that surrounds and protects a baby during pregnancy is removed from the uterus for testing. Number 2 is the fetal ultrasound. Fetal ultrasound is an imaging technique that uses high-frequency sound waves to produce image of a baby in the uterus. A detailed ultrasound can help your healthcare provider evaluate fetal anatomy. Fetal ultrasound also might give you an opportunity to find out the baby's sex. The third test is the blood test. It might be offered between week 24 to 28 of pregnancy to check your blood count and iron levels and screen for diabetes that can develop during pregnancy, or the also known as gestational diabetes. If you have rhesus or Rh negative blood, an inherited trait that refers to a specific protein found on the surface of red blood cells, you might need a blood test to check for Rh antibodies. These antibodies can develop your baby's has Rh positive blood, and your Rh negative blood mixes with your baby's blood. Without treatment, the antibodies could cross the placenta and attack the baby's red blood cells, particularly in a subsequent pregnancy with a baby who has Rh positive blood. Let's move into the third trimester of pregnancy between week 28 to birth. Prenatal care is an important part of a healthy pregnancy, especially As your due date approaches, your healthcare provider might ask you to schedule prenatal care appointments during your third trimester about every 2 or 4 weeks, depending on your health and pregnancy history. Starting at 36 weeks, you'll need weekly checkups until you deliver. You'll be asked if you have any signs or symptoms, including contractions and leakage of fluid or bleeding. Your healthcare provider will check your blood pressure and weight gain, as well as your baby's heartbeat and movements. Your healthcare provider might ask you to track of how often you feel the baby move on a daily basis, and to alert your healthcare team if the baby stopped moving as much as usual. Also, talk to your healthcare provider about any vaccinations you might need, including the flu shot, the tetanus toxoid, reduced diphtheria toxoid, and acellular pertussis or the Tdap vaccine. Ideally, the Tdap vaccine should be given between 27 to 36 weeks of pregnancy. Expect to be screened for Group B streptococcus or the GBS during the third trimester. GBS is a common bacterium often carried in the intestines or lower genital tract that's usually harmless in adults. But babies who become infected with GBS from exposure during vaginal delivery can become seriously ill. To screen for GBS, your healthcare provider will swab your lower vagina and anal area. The sample will be sent to a lab for testing. If the sample tests positive for GBS or you previously gave birth to a baby who developed GBS disease, you'll be given intravenous antibiotics during labor. The antibiotics will help protect your baby from the bacterium. Near the end of pregnancy, your healthcare provider might check to see if your baby is positioned head first in the uterus. If your baby is positioned rump first, frank bridge, or feet first, complete bridge, after week 36 of pregnancy, it's unlikely that the baby will move to a head first position before labor. You might be able to have an external cephalic version. During this procedure, your healthcare provider will apply pressure to your abdomen and physically manipulate your baby to head first position. This is typically done with ultrasound guidance by an experienced doctor. If you prefer not to have this procedure, or if your baby remains in a bridge position, your healthcare provider will discuss planning a C-section delivery or the cesarean delivery. Adios! That's all, and thank you for watching.